Hello viewers, you are welcome to a new episode of our educational videos. In this clip, I will be talking about introduction to nursing as a profession. Nursing has had a significant impact on people's lives as rapid change continues to transform the profession of nursing and healthcare system. Today, nurses bring knowledge, leadership spirit, and vital expertise to expand their role that afford increased participation, responsibility, and reward in order to make nursing a standard profession. Let us look at contemporary nursing practice. An understanding of contemporary nursing practice look at definition of nursing, recipient of nursing care, scope of nursing practice, and current standards of clinical nursing practice. Let us look at definition of nursing by various scholars. According to the mother of nursing, Florence Nightingale, sees nursing as an act of utilizing the environment of the patient to assist him in his recovery. In this definition, Nightingale considers a clean, well-ventilated, and quiet environment essential for recovery. While for modern-day nursing, Virginia Henderson said that the unique function of the nurse is to assist individual, sick or well, in the performance of those activities contributing to health or its recovery or to a peaceful death. That he would have performed unaided if he had the necessary strength, will or knowledge, and to do this in such a way as to help gain independence as rapidly as possible. Virginia Henderson described nurses' role as doing for the person, helping for the person, and working for the person. For International Council of Nurses, they said that nursing encompasses an autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. Also in 1980, American Nurses Association, ANA, sees nursing as the diagnosis and treatment of human response to actual or potential health problems. Canadian Nurses Association describes nursing practice as a dynamic, caring, helpful relationship in which the nurses assist the client to achieve and obtain optimal health. Now, let us look at certain terms that are common to the definition of nursing. All the definition I have given you, see nursing as a caring profession, nursing as an art, nursing as a science. Nursing is client-centered, nursing is holistic, nursing is adaptive, nursing is concerned with health promotion, health maintenance, and health restoration. Nursing is also unique and independent profession. It's also a helping profession. Let us look at recipient of nursing care. There are three basic recipients of nursing care. One, consumer. A consumer is an individual, a group of people, or a community that uses a service. People who use healthcare products or services are consumers of healthcare. Patient. A patient is a recipient of nursing. Patient is a person who is waiting for or undergoing medical treatment and care. The word patient comes from a Latin, meaning to suffer or to bear. Traditionally, the person receiving the healthcare has been called a patient. Client. A client is a person who engages the advice or services of another who is qualified to provide the services. The term client presents the receiver of healthcare as collaborators in the care, that is, as people who are also responsible for their own health. Scope of nursing practice. Nurses provide care for three types of clients. It's either they provide care for individuals, families, or the communities. Nursing practice involves four areas: promoting health and wellness, preventing illness, restoring health, and all care of dying. Let us look at promotion of health and wellness. Wellness is a state of well-being, It means engaging in attitude and behavior that enhance the quality of life and maximize personal potentials. Nurses promote wellness in a client who are both healthy and ill. It involves individual and community activities to enhance healthy lifestyle, such as promoting nutrition and physical fitness, preventing drugs and alcohol misuse, restricting smoking, and preventing accident and injury in the home and workplace. Preventing illness. The goal of illness preventing program is to maintain optimal health by preventing diseases. Nursing activities that prevent illness include, among others, immunization, prenatal and infant care, prevention of sexually transmitted diseases, and also basic environmental and personal hygiene, restoring health. This focus on the ill client, and it extends from early detection of diseases through helping the client during the recovery period. Now let us look at care of dying. This area of nursing practice involves comforting and caring for people of all ages who are dying. It includes helping clients live as comfortable as possible until death, and helping support person cope with the death. Nursing activities in the clinical setting. Several of activities in the clinical setting that a nurse performs. Among others, providing direct care to ill person, such as administration of medication, birth, and specific procedure and treatment. Performing diagnostic and assessment procedures such as measuring blood pressure, urine testing, and examining feces for occult blood. Consulting other healthcare professionals about client problem. Teaching clients about recovery activities such as exercise that will accelerate recovery after a stroke. Rehabilitating clients to their optimal function level following physical or mental injury or chemical addiction. Roles and functions of the nurse. Nurse as a caregiver. A caregiving role encompasses the physical, psychological, developmental, cultural, and spiritual levels. The nursing process provides nurses with a framework for providing care. A nurse may provide care directly or delegate it to other caregivers. Nurse as a communicator. Communication is integral to all nursing roles. Nurses communicate with clients, support persons, other health professionals, and people in the community. Nurse as a teacher. As a teacher, the nurse helps clients learn about their health and healthcare procedures they need to perform to restore, promote, or maintain their health. Nurse as a client advocate. A client advocate acts to protect the client. In this role, the nurse may represent the client's needs and wishes to other health professionals, such as relaying the client's wishes for information to the physicians. They also assist clients in exercising their rights and help them speak for themselves. Nurse as a counselor. Counseling is the process of helping a client to recognize and cope with stressful psychological or social problems, to develop improved interpersonal relationships, and to promote personal growth. It involves providing emotional, intellectual, and psychological support. Nurse as a change agent. The nurse acts as a change agent when assisting others. That is, clients to make modification in their own behavior. Nurses also often act to make the changes in the system, such as clinical care, if it is not helping a client change in the health care system. Nurse as a leader. A leader influences others to work together to accomplish a specific goal. A leader role can be employed at different levels, either at individual client, family, group, or colleague, or in the community. Nurse as a manager. The nurse manages the nursing care of individuals, families, and the communities. The nurse manager also delegates nursing activities to other nurses and supervise and evaluate their performance. Managing requires knowledge about organizational structure and dynamics, authority and accountability, leadership style, delegation, supervision, and evaluation skills. Nurse as a case manager. Nurses case managers work with disciplinary healthcare team to measure the effectiveness of case management plan and to monitor the outcome. Each agency or unit specifies the role of a nurse case manager. Nurse as a researcher or research consumer. Nurses often use research to improve client care. In a clinical area, nurses need to create awareness of the process and language of research, be sensitive to right of human subject, identification of significant researchable problem, be a discriminating consumer of research findings. Thank you for watching. Please don't forget to subscribe, like, and drop your comments at KB Nurses Documentary.